Hi, this is Erin. Here's a pamphlet about systemic sclerosis, or more commonly known as scleroderma. I had a grandmother who passed away from scleroderma, so it made me really want to dive deeper into this disease and see why it occurs. So, to begin, systemic sclerosis is an autoimmune disease in which the body's immune system attacks its own tissues. So, your normal immune system, which helps you fight off abnormal beings within your body, is now attacking normal tissues. And this constant attack is causing constant inflammation, which damages the skin, resulting in a very hardened skin and vessels and internal organs. It is the most severe connective tissue disease associated with high mortality risk. And there are two types. There's limited cutaneous. It is a thickening of the skin that involves the face, hands, forearms, lower legs, and feet. So you can think of the lower ends of your extremities. And there's also diffuse cutaneous, which is a more severe and widespread disease, where it includes the face, hands, forearms, upper arms, thighs, and trunk. It is important to differentiate the two of these because diffuse normally is one that can affect your organs. Next, we're going to dive into the etiology and pathogenesis of scleroderma. So, the etiology is the cause of the disease, and unfortunately, the cause is unknown. But with the pathogenesis, it's the manner of the development of the disease. And on a positive side, we do know of some sort of cause for why this is happening to a person that's having the scleroderma symptoms. So, the abnormalities in the immune system include the production of certain types of T cells and fibroblasts that promote vascular damage and fibrosis. And fibrosis is scar tissue that is a buildup of collagen and fibroblasts that make the skin tissue very dense and not flexible like normal tissue, healthy tissue is. These cells have been linked to a genetic mutation within the HLA system that are exclusive to patients with scleroderma, which is an awesome finding to know that, okay, there is a genetic component. So, being able to dive in deeper, and there is more research going on with this component to be able to find more treatments and causes for why this is happening. And so the conclusion is that there is a disruption in the controlling of the T cell activations. It's activating for a reason, and we're not quite sure why, but there is something wrong with this activation of T cells, which is causing the vascular damage and fibrosis and all the negative characteristics that come along with scleroderma. So there are 3 stages of scleroderma. The first stage is the edematous stage, where there's bilateral edema in the fingers, hands, and it can progress to the forearms, arms, upper chest, and abdomen, back and face. The next stage is where that edema turns into a thick and hardened skin, which is the fibrosis or the scar tissue that develops. And the atrophic stage is when the sensory fibers in the affected skin are reduced, which results in vasoconstriction of the skin. And that will usually have the effect of Raynaud's phenomenon, which we'll talk in the signs and symptoms. So the signs and symptoms include the inflamed skin, swelling, color, and nail changes. There's also thick and tight skin with waxy or shiny appearance that can cause a lot of itching. And this is from the fibrosis and the tightening of the skin. There's difficulty swallowing due to also the restriction of the skin and the tissue. Raynaud's phenomenon is the spasm within the blood vessels that supply the hands and feet, and they become narrow, causing the skin to become white and numb and then almost bluish as the blood flow remains blocked. And so this is caused when the patient is stressed or exposed to the cold. There's also joint pain and loss of range of motion, restrictive lung disease, heart arrhythmias, renal disease, and 50% of adults report major depression, sexual dysfunction, trigeminal neuralgia, hypothyroidism, dental involvement, and corneal tears. So, as you can see, there are a lot of signs and symptoms. Therefore, it's important to be well educated on this disease and know how to treat those symptoms. The diagnosis of scleroderma can be determined through blood work and skin biopsy. The blood work will test for a particular antibody, and the blood work will also rule out other diseases that may present similar to the early stages of scleroderma. A skin biopsy will be able to show the biology, the tissue of the skin that is unique to scleroderma as well. Chest films, pulmonary function studies, GI series, and an EEG may be done, especially if the scleroderma has progressed to affect those systems. Next is medical management, and there has been no evidence-based treatment for scleroderma. However, there has been a few treatments such as medications, exercise, joint and skin protection techniques, and stress management that has helped alleviate the symptoms of scleroderma. Unfortunately, scleroderma is not reversible, but being able to slow down the progression of the disease is definitely helpful. Research has been found to see that stem cell transplantation is promising. So this gives good light for the future, for the future treatment plans. Next is the importance of physical therapy. And the physical therapist can have many roles for a patient with scleroderma, depending on what their symptoms are and the extent of the disease at that time they're seeing them. The therapist can help with easing the itching symptoms of the tight skin by giving them methods to soothe the skin. And if the skin forms an ulcer, the physical therapist may also be able to apply appropriate dressing to promote healing and prevent trauma and infection. If there is an infection that occurs, then they would refer the patient to a physician or to an emergency room. Physical therapists can help with strengthening and range of motion exercises. It looks like there's a little typo there, strengthening. For regular exercises, they have to be accountable of the type of disease progression that the patient has, being careful with their joints and not trying to cause any inflammation. And they'll give regular exercises to the patient in order to keep the skin and joints flexible, maintain good blood flow, and prevent contractures or that scar tissue buildup. Being able to teach the patient ways of living to help prevent any stress or additional strain on the joints would be an awesome thing to do as well, because of the limited range of motion and strength that they have from the disease. A light splint may also help protect the joint and skin, and the exercises again will vary per patient, especially if there is the heart and lung impairments with those suffering with diffuse scleroderma. And also with diffuse scleroderma, they are often experiencing anxiety because there are rapid changes within their body, and they are at the greatest risk for visceral disease and early mortality. So, being able to educate the patient of the disease, identifying their history, and being able to be aware of what they're going through, and having their family on the same page is definitely important. And that includes my presentation. Please let me know if you have any questions, and be sure to see a physical therapist or your primary care for any direction to your concerns. And if you feel that you are representing with any of these symptoms or feel that you have symptoms of other diseases.